Hi everyone, so today we are talking about corns.
Corns are effectively an area of hard skin that forms on your feet, and it forms into a centre which can be really painful. It feels like you're walking on a stone, or when they form between your toes it can feel like burning between the toes. They can form on the balls of the feet, the heels, tips of the toes, between the toes, tops of the toes, absolutely anywhere that you get pressure really.
You can care for yourself if you have a corn, and the first thing we recommend that you do is to file the hard skin that's forming over the top of the corn, and this will really help to take the pressure down and some of the pain away.
Absolutely. You can also buy padding from pharmacists, even some supermarkets, which you can use to stick to your feet to sort of take the pressure off the corns. And you can buy corn plasters, which contain a product called salicylic acid, which helps to soften the skin. And that can be really useful, although you have to be super careful with these because we've seen instances where people have maybe got a sore, an ulcer or an infection because of using these incorrectly. So just be really careful and read the packaging.
You might also want to consider altering your footwear. If you have a tight shoe or a shoe with a very thin sole, or a pointed shoe or a shallow shoe, these will all create some pressure that can cause corns. So you might want to rethink your shoes.
You should see a podiatrist when you can't manage the pain from your corns yourself. Podiatrists use a really simple technique called enucleation, which is a scalpel technique to remove the corn. It sounds a little bit scary, but it's really not as bad as it sounds. And the amazing thing is that once you've had that done, you can put your feet to the floor and the corn pain is gone and everything just feels lovely again.
True. Your podiatrist will also look at your foot mechanics. This means where is the high pressure and what's causing the corns in the first place. Sometimes there's a bone or an area of high pressure that we can identify, and we might be able to give you an insole or an orthotic device to go in your shoe to help to offload that pressure and prevent that corn from coming back again.
Absolutely, and don't be offended if your podiatrist does comment on your footwear. They're not doing this to be awkward, it's just to give you the best advice to make sure you're wearing the shoes that are helping you with your pain from your corns.
So if you want to find a podiatrist that's registered and locally to you, go to our homepage at podipedia.co.uk.